Hi, I'm Dr. Sitrat from Bill and White All Saints Medical Center. Today, I would like to discuss if Streptococcus bovis or Strep bovis is the cause or the result of colorectal cancer. An association between Strep bovis bacteremia and colorectal cancer are discovered in early 1970s. Strep bovis has two biotypes. It's biotype 2 that is associated with colorectal cancer. There was a study showing that biotype 1 is associated with colorectal cancer with a prevalence of 94%, while the prevalence of colorectal cancer in biotype 2 is 18%. For case presentation, there's an 87-year-old female with a past medical history of carotid artery stenosis that is post-stent, coronary artery disease that is post-PCI, CABG, history of recent transcatheter aortic valve replacement or TAVR, and other comorbidities, who presented with a 2-day history of fever, chills, fatigue, weakness, nausea, and vomiting. Her blood culture grew Strep bovis. Due to history of recent TAVR and presence of a pacemaker, a TEE was performed and showed ill-defined structure or lead in the right atrium suggesting thrombus versus infected lead. She was treated with ceftriaxone for device-related endocarditis for 4 weeks. A colonoscopy was performed and showed transverse colon polyp, and pathology report showed tubular adenoma. Patient received polypectomy. For discussion, it is controversial whether Strep bovis is the cause of colorectal cancer or a consequence of the disease. There are several assumptions about Strep bovis and colorectal cancer. One study suggested that chronic inflammatory response to Strep bovis could cause malignant transformation of colonic mucosa. Another study also demonstrated that Strep bovis has a strong tendency to form biofilm on collagen-rich surfaces, which in vivo are found on precancerous sites with a displaced epithelium and damaged heart valves. Another mechanism showed that Strep bovis has a capability to increase vascular permeability and facilitate bacterial translocation into the portal circulation. Then the bacteria can bypass the hepatic reticuloendothelial system and access the systemic circulatory easily. Despite the association between Strep bovis and colorectal cancer remains unclear, it's highly recommended to perform a colonoscopy after Strep bovis bacteremia is detected.